The Center for Disease Control reports that 30 million people in the United States have osteoarthritis. And joining us is Dr. Karl Koenig. He's an orthopedic surgeon and medical director at the UT Health Austin Musculoskeletal Institute. Thank you so much for joining us. Can you explain what this condition is?
Sure, Tom. Thank you very much for having me. So, this is a very good question, and many of our patients have the same one. And so, arthritis comes in two major classes. One of them is inflammatory arthritis, which is really kind of when a person's immune system goes awry and those cells begin to attack the cartilage in their joints. You might have heard this referred to as rheumatoid arthritis or psoriatic arthritis. That's a more rare cause. The much more common cause is what's called osteoarthritis, or the general wear and tear that you see on a joint. So, at the end of every bone, there's a smooth surface called cartilage, which you can see on a model like this, right? Where you can kind of see what cartilage is supposed to look like, and that allows two bones to glide past each other without having any friction. And that works really well for quite a while, but over your lifetime, you can have damage to your cartilage, or you can start to have aging, and then you'll start to see that.
And hold that up just a little higher so you can see that. The
cartilage can start to wear away, and then it can actually start to cause pain. And so this is what osteoarthritis is, and many people experience it over the course of time. The causes are a combination of things, so it can be due to your genetics. Some people are more prone to getting osteoarthritis than others, but there isn't a specific gene or a specific test that we can do to say, oh, you're going to have it. It certainly happens to everyone as we age. The cartilage wears away and it doesn't regenerate itself, and so everyone gets it to some degree. And then there really are mechanical forces that have a lot to do with it. So, being overweight and, doing really hard labor and those kinds of things can cause the cartilage to wear out a little bit faster. And so the combination of all those things is what really can lead to the condition.
And so if you get this condition, you're diagnosed with it, what can you do about it?
It's a great question. So, a lot of people think, well, my joint starts to hurt, so I should do less. And it's kind of the opposite that's true. You really need to stay active and you need to do things. And so, what we really like to do is make sure that you can stay healthy and active in your lifestyle. So the cartilage is surrounded by something called synovial fluid, which is actually how it gets its nutrition. So moving the joint actually moves that fluid around and allows the cartilage to stay healthy, slowing down the degeneration. Also, strengthening the muscles around the joint very specifically with exercises can prevent the symptoms and slow them as you move forward. And then there are other things that we can offer, such as medication sometimes to help with the inflammation. If things get really severe, sometimes you might want to have an injection of medication into your joint. And then at the real end stage, if it's interfering with your quality of life, then things like joint replacement surgery can be helpful.
And so if you think you have this, should you see your doctor? And then if they, recommend them to you, I guess what's that initial process like, that initial consultation?
Absolutely. I mean, it depends a lot on how much it's affecting you, because a simple, when I get up in the morning my joints are a little stiff and I can walk around and they get loose and I can feel better, then you don't necessarily need to see your doctor for that. But if you find that your symptoms are interfering with your quality of life, your ability to go out and walk and be healthy and do the activities that you like to do, then that's really when you should seek care. And so at the Musculoskeletal Institute at UT Health Austin, we actually have a whole team of people who are dedicated to doing this, because the things that you can do for treatment are provided by different specialists. And so, we have a physical therapist on our team if you decide to do exercises. We actually have a dietitian on our team if you're going to try to work on your weight and try to lose that. If you have a problem that's so bad that you need surgery, we have a surgeon on our team. And so that's one of the ways that we approach it. But that's when you should seek care. If you find that you're not able to do the things that you need to do, we really want to help you with that.
All right. Well, thank you so much for joining us, Dr. Koenig. It was very interesting learning